Welcome to Suffolk Matters, where all of Suffolk County meets the men and women of Suffolk AME. News, opinions, and insights you won't hear anywhere else.
Welcome to another edition of Suffolk Matters on Walk 97.5 and 94.3 The Shark, where Suffolk County meets the men and women of Suffolk AME. News and views you can't hear anywhere else.
Good morning and welcome, listeners, to another episode of Suffolk Matters. Your regular host, President Dan Leveler, is out today, and you are joined by Ryan McGarry, Chief of Staff for AME. With us today is Nick Stefanizzi, the Vice President and CEO of Northwell Direct. Good morning, Nick. Welcome to the show. Thanks for being here.
Morning. Thanks for having me.
No, absolutely. I mean, just to get off the ground, I know almost all of our listeners, without a doubt, have to be familiar with Northwell Health, who Northwell Health is, and the great services they provide. But what is Northwell Direct? I don't think our listeners are probably as familiar there. So you're CEO of Northwell Direct. What is Northwell Direct? Who do you serve?
Yeah, thanks for asking. So Northwell Direct is the direct-to-employer business organization that is owned by Northwell Health. A lot of people will know Northwell Health as primarily, rightfully, a care delivery system. With hospitals and with physician offices. But the health system also has a very rich history and tradition of creating businesses and creating innovative initiatives based on our experience to help to diversify the revenue streams of the health system and create new opportunities for the system to reinvest in the care delivery infrastructure, to keep our facilities modern, to make sure that our physicians and providers have all of the latest technology and tools. Northwell Direct is a great example of that rich history and innovation that the health system has championed over many, many years. And so it is a standalone business that is owned by the health system, and we are focused on partnering with employers to help them find access to high-quality healthcare solutions for their team members. And we try to do that at a lower, more sustainable price point than what they might experience in the market otherwise. And we've been working over the last 2 years with a really diverse range of employers, everything from providing clinical services on-site and virtually to their team members, and also offering them solutions for their employee benefit plans.
Oh, fantastic. And since it is direct to employer, if our members are listening that aren't necessarily employers, should they talk to maybe their employer about this, or what type of employers does Northwell Direct directly engage with?
The nice thing about our solutions, I like to say, is that they work for any employer, regardless of shape or size. We've worked with small businesses up to large enterprise organizations, public, private entities over the last several years. So everybody from the Port Authority of New York and New Jersey to Whole Foods to local businesses across Long Island. So we have services and solutions that can meet the unique needs of any employer. And what's also interesting is that because we work directly with the employers, we have the ability to customize our services that we're offering to their team members based on their unique needs, based on the culture of the organization. And that, I think, is sort of special and different about the work that we're doing. It's not a cookie-cutter solution like many of the other healthcare vendors that are out there. We take a really in-depth approach to making sure that we customize and tailor what we deliver for an employer's unique needs. And so, yeah, if somebody has a need or an interest in health and well-being services that maybe their employer isn't offering today, or an idea or a suggestion, I would absolutely recommend that they encourage their employer to reach out to us, because it's going to be pretty rare, given the breadth of the health system. It's pretty rare that we don't have a solution to meet a need that is expressed to us by an employer.
Oh, that's fantastic. So custom-made, tailor-made options directly engaged with the employer and themselves. No organization too large, no organization too small. So you're working with both the Main Street small business as well as these regional and even international companies that you mentioned. And your team is able to tailor and custom package, different benefit packages for these very different and varied organizations without issue. How do you manage that with terms of staffing and keeping your fingers on the pulse of so many different clients?
Well, one, I'm very lucky in that I have a really great team.
You do.
And
I will admit to that. We've worked well together with them, so congratulations. They are under a good leadership, I know, as well.
Well, thank you. That's very kind of you to say, but I consider it a privilege every day to be able to be a part of this team and to be able to play a small part in working with these employers and taking care of their team members and helping them to better manage their own health and well-being. So, your team and the people that are responsible for this are a big driver of your success, as you know very well. And I'm very lucky in that I have a great, highly innovative, highly driven, highly motivated team that works tirelessly every day to make it possible to do the work that we do. That's the first part. Secondary to that, we have the benefit of being part of the health system. And the health system is now 80,000 strong. Northwell Health is not only the largest care delivery system in the state of New York, but Northwell Health is also the largest employer in the state of New York. And so in addition to the amazing, talented team that I have within Northwell Direct, we're able to draw upon the resources and expertise of the broader health system. And that's one of the unique benefits of being sort of a startup within a larger enterprise organization. We have a tremendous amount of support and clinical expertise that we're able to draw upon to do what we need to do on behalf of these employers.
No, it's amazing and very impressive. And I know you're singing the praises of your team, and rightfully so. But, please take a moment to beat your own chest a little bit, because you boast a pretty impressive resume. You have a lot of experience before you came to Northwell Direct as CEO. If you wouldn't mind, for our listeners, just kind of going over your background. I know you have a background with Northwell Health before going over to Northwell Direct, as well as some other impressive organizations in the field. So, yeah, please, if you wouldn't mind, just giving us a little background on Nick.
Yeah, sure thing. And you're very generous, and I really appreciate that. What I would say is I've been a part of the broader Northwell extended family for the last 13 years, basically my entire career. And I think that speaks to the incredible culture and great opportunities that are available to team members within the health system. It truly is a great place to work. There is a reason why 3 years in a row the health system has been a Fortune 100 rated best place to work, because it truly does provide all of its team members with some really unique opportunities and experiences. I've had the benefit over the course of my career of having the opportunity to do and try a variety of different things within the health system. And so the first half of my career with the health system was really focused sort of within the four walls of the traditional not-for-profit delivery side of the organization. And so I started in technology. I was chief of staff to their chief information officer during a pretty dramatic period of growth and transformation in our IT systems, deployment of electronic medical records across the organization. Just some really interesting, unique work. So spent a couple years in technology, then moved over to the physician network, supporting what was then 450 physician practices. That's now grown to over 800.
Wow.
So again, just illustrative of the tremendous growth that the health system has gone through. But really working day to day to make sure that the providers had what they needed to take care of their patients, and that their practices and the staff within those practices were well supported. And then I also spent time within human resources leadership, focused on talent management, employee engagement, and some other strategic HR-related initiatives. After that, sort of the second phase of my career has been in some of these entrepreneurial ventures that the health system has started, which I mentioned when I was talking about how Northwell Direct came to be. And so just prior to Northwell Direct, I spent some time in a startup that was created by the health system that was really focused around patient access and navigation, access to clinical services, as well as some back-end functions supporting physician practices. We grew that business with a variety of partners around the country. And about 2 years ago, a little over 2 years ago now, the health system asked me to step over into the role leading Northwell Direct. And it's just been such an incredible ride, such a great experience, a lot of hard work, but also a lot of fun.
No, absolutely. You're doing a tremendous job. And I have to ask, because Northwell Direct is so new, and as you mentioned, you just went over there just over 2 years ago. I think whenever anybody right now hears just over 2 years ago, they think of the way the world changed 2 years ago. How did the COVID pandemic and coinciding with the timeline of your starting Northwell Direct, how did that pandemic impact what you were trying to achieve and the services you provide?
To put it simply, I would say it was disruptive.
I would imagine so, yes.
And perhaps that's an understatement. We launched Northwell Direct in the second quarter of 2020. It had been in development for several years, and we had developed sort of the range of services that we were going to be offering out into the market, none of which included anything related to COVID. And then the world got turned upside down by the pandemic. And we knew we very quickly had to pivot in order to be able to partner effectively with employers, because we knew that employers, like everyone else, were grappling with how to navigate the constantly changing circumstances that we faced throughout the pandemic. And so in the early part of the summer of 2020, the team sort of regrouped and we said, what do we think we can do for employers to help them navigate this, to help them support their team members through the pandemic? And we worked with clinical experts from around the health system to develop a range of COVID-related offerings that we could bring to employers. So everything from testing, which, as you recall, in the early stages of the pandemic was incredibly scarce. And so we were able to bring testing solutions out to employers. We were able to offer our clinical expertise, so actually bringing our expert clinicians in things like infectious disease, occupational medicine, to the table as consultants to businesses, so that as the executives of these companies were making decisions about their business strategy, they were being informed by clinical experts from the front line, bringing that expertise sort of into the boardroom, if you will. We also created some capabilities around clinical triage and navigation. So again, given some of what was going on in the communities with scarcity of testing, we were able to offer solutions to employers so that if their employees believed they had an exposure or were starting to experience symptoms that might be COVID related, they could pick up the phone, get clinically triaged by a nurse or provider, and then navigated to appropriate care if follow-up care was needed. So, we really stepped back, were thoughtful about how could we make an impact and how could we best support businesses through the pandemic, spun up some products and services around those things, and got out to market. And what we found was there was incredible interest. And, look, the health system was on the absolute front lines of the pandemic. The governor at the time had reached out to Northwell for us to take a lead role, not just locally in helping the response, but also in managing the Javits Center and what was stood up there to help with surge capacity within the city. The naval ship Comfort that had been brought up, Northwell played a lead role in helping to provide clinical oversight and operational support to that. So in many ways, Northwell was on the front lines. It was kind of rare that in the height of the pandemic, you didn't see Michael Dowling out there on TV leading the charge. And so what we found was that employers similarly looked to us and said, please come help us. And so we were able to partner with a whole range of different employers, from JetBlue to, as I said, the Port Authority of New York and New Jersey, to smaller local retailers across Long Island, to schools, to help them develop protocols and deliver services to their employees. And, you know, it was challenging, right? Like everybody, we experienced and felt the challenge of the pandemic. But it was really nice in that not only did it feel like we were helping people navigate and provide necessary services, it also felt like through Northwell Direct, we had an opportunity to support the economic recovery of the New York metro area, and getting these businesses back up and running, getting employees back to work, keeping them safe while they were doing it. And that was certainly very rewarding and a very meaningful experience for us over the last 2 years.
No, and an extremely important aspect to the whole pandemic, making sure that while we were shutting down so much of the economy, that we were still able to keep the economy going, operational, keep people working, keep people safe throughout this pandemic that nobody alive had ever experienced anything like it before. So questions abound, and knowing that employers had the resources and the network that Northwell Direct was able to provide, I'm sure it was a huge peace of mind, giving those employers tremendous amount of confidence that they can continue operations even if under new models. So I'm sure they were very grateful for your services and the expertise you bring to the table. Just quickly, AME Chief of Staff Ryan McGarry filling in for our President Dan Leveler today on Suffolk Matters. Our guest is Nick Stefanizzi, Chief Executive Officer of Northwell Direct. And Nick, while we've been talking a great deal about all the great services Northwell Direct can directly provide to employers and organizations, one of the things before we get back into those services that I want to touch upon, because it meant such a great deal to myself personally, but also our executive board and our members, was Northwell Direct's charitable support of our big nonprofit endeavor every year, which is the May Day Music Festival. You guys, for the 2022 May Day Music Festival, which was just over a month ago, we're an integral sponsor of the event. For our listeners who are pretty familiar with it, the goal of that festival is to raise awareness of issues facing working people while simultaneously raising money for both scholarship funds and for our friends over at Long Island Cares to help put food on our neighbor's table. When we made the outreach to you, you stepped up, you and your team, and sponsored this event. We can't thank you enough. So I did want to thank you for that, and I do want to thank your team. I know you had to leave a little early that day, but they braved the storm, and they stuck out through the deluge that came, unfortunately impacting turnout more than we had hoped, but still a great day for those in attendance. Was just curious what you and your team thought of the event and what it meant to you to be involved.
Yeah, well, weather aside, what a terrific event and what a terrific cause. And it was an honor for you to ask us to participate and to provide support, and a privilege to be able to be a part of it. And that mission that you outlined, the focus behind the festival, is so meaningful and so important. And, as healthcare providers, as a provider-based organization, we view ourselves as an extension of the community. And so our mission extends beyond just taking care of people when they're sick. It's really about how do we improve overall health, well-being, and livelihood. And it felt like being a part of the May Day Festival was an opportunity for us to support that mission and support your members and support the community. And so it was a privilege to be able to be there and be a part of it. I know that the team really enjoyed the event. It was great to get to interact not only with the members of AME, but also the members of the community that were there to celebrate and to support one another. And certainly after 2 years of the pandemic, it was nice to be back gathered outdoors in a way that was safe, but where you could physically interact with one another again. I think we've all been a little bit hungry for that over the last 2 years.
No, absolutely, and we appreciate that perspective, and we were just honored to have your support. We hope to have it again. And then going back, again, for our listeners who might just be tuning in, Can you just explain briefly, not as in-depthly as we've already covered in the show, but what Northwell Direct is, how direct contracting works as your model, and how this direct employer relationship works?
Yeah, so Northwell Direct is the direct-to-employer business arm of Northwell Health. And we focus every day on partnering with employers to help provide them with health and well-being solutions for their team members. We try to do that in a way that'll help them save money on top of keeping their team members healthy and resilient. And we do that in a variety of ways. We have a range of what we call at-work services that we can deliver in the office or virtually. Everything from flu shot campaigns to tele-behavioral health to on-site health and well-being centers. And then we also have solutions around direct contracting for employee benefit plans that offer pretty significant savings, up to 20% we see on average, in contrast to the traditional insurance carriers. And we offer that to employers. We also offer it to labor funds. And we're seeing a lot of interest in seeking out alternatives to the traditional insurance carriers.
20% savings is far from insignificant. So how do you achieve those savings? And
yeah, it's far from insignificant. And I think even more so, I mean, we just talked about the pandemic. And certainly, first and foremost, the pandemic impacted people's lives, their health, their sense of safety and security. But let's also acknowledge the pandemic had a pretty significant financial and business disruption over the last 2 years. And I think as a result of that, organizations are taking stock and having to make some difficult decisions, especially when the traditional insurance carriers are coming back with double-digit increases in benefit costs. And we could have a whole discussion about whether that's right, wrong, or indifferent after 2 years of a pandemic and record returns to the shareholders of the traditional insurance carriers. But I think organizations are realizing, given all of that financial and business disruption, there has to be a different way. And the savings are real. 20% is something that's got to be taken seriously. But in addition to the savings, what I would say is we also stand strongly and firmly behind the quality of the clinical services that are available through our network offering. It is a high-performing, selective network of over 22,000 providers, 50 hospitals across the New York metro area that allows us to really meet team members where they are without disruption. And so we're really excited about the work that we're doing on a direct contracting basis with unions as well as employers.
No, fantastic. So if there's a listener out there or a company or organization that's interested in maybe switching to a self-insured model or switching networks, what advice would you offer? And you've referenced minimizing disruption. So how do you go about minimizing those disruptions in those cases?
Yeah, so there are a couple things that come to mind that I think are really important for organizations to think about as they contemplate a direct contracting relationship. The first is, what network are you choosing? What providers are a part of the network? And as I said, we have over 22,000 providers that participate within the Northwell Direct network, over 50 hospitals. The foundation of that was Northwell Health, but we knew that if we were going to effectively serve employers in the New York metro area, we had to push into places that the traditional reach of the health system didn't touch. So we knew we had to be in the Bronx. And so we partnered with Montefiore to bring them into our provider network. We knew we had to be in northern New Jersey. And so we partnered with RWJ Barnabas and brought them into our network. We've pushed up into southern Connecticut and brought in other partners to complement the already strong foundation that Northwell Health provided. And so, I share all that just to give you a geographic sense of the reach of the network that we've built. And what we do with any employer or organization that we engage with is we will literally run a disruption analysis and look at who are the providers your team members are seeing, and how does that compare to what's in our network. And we on average see over 85 or 90% overlap between what we're able to provide in Northwell Direct and historical utilization. And I think that speaks to the strength of what we're able to provide in our network. But that's really important, that who is the network, who are the providers, who are the partners, is really important for organizations to think about. The other thing that's really important is who's the administrator? Who is actually going to process the claims? Who is going to pick up the phone and provide customer support to your members? And there are a whole range of third-party administrators out there in the market. I would say be really thoughtful about who you select as your partner. We like to say we're TPA agnostic. We'll work with whoever you have a relationship with, but we also have several TPAs that we've created preferred relationships with that are tightly integrated so that it is seamless to the employers and organizations that we're working with. And the last thing that I would say is talk to your benefits broker or consultant, and let's have a conversation. And let's look at the data, and let's really explore this together, because that's the real benefit of a direct contracting relationship. The business is sitting right across the table from the provider organization, without a middleman, without an intermediary. Let's look at what are your unique needs, how are we positioned to fill them, and collaborate together and have a true partnership.
No, beautiful. You bring a tremendous amount of resources and a great network that extends beyond even the far reaches and impressive reaches of Northwell Health alone. So it's amazing to see your ability to bring those partnerships to your clients and the organizations you work with. But you mentioned have a conversation. So how do folks who are interested have that conversation? Where do they go? Who do they call? How do they reach out to you to start those conversations?
Anyone that's interested is absolutely, I would encourage anybody that's interested to reach out directly to us. We have a website, so you can look up Northwell Direct online, get to our website, and we have a contact us form that is available through our website. We are also in touch with brokerages and consultancies that provide benefits support across Long Island, across the New York metro area. And so I would venture a guess that if an organization asks their benefits broker or consultant about Northwell Direct, they also know how to get a hold of us. Beautiful. Because our sales and business development team have deep relationships with benefits brokers and consultants. But yeah, get online, get to our website, submit a form. We're happy to reach back out to you and get in touch and start that conversation.
Beautiful. And one of the last things, because we're almost out of time, but I didn't get to ask yet, is your care management solutions. What is meant by care management solution? How can this help employees of a given organization?
Care management is really about how can we make it as easy as possible for an individual to take ownership and control and to manage their own health and well-being. And we have a range of patient-centric, team-based care management programs that we offer up to employers and their team members who have adopted the Northwell Direct network solution for their employee benefit plan. So on the one hand, it could be proactive engagement around screenings that you might benefit from based on a particular clinical condition like diabetes. Okay. On the other hand, it could be, you unfortunately are admitted to the hospital. And before you leave, we'll deploy a nurse to your bedside on behalf of Northwell Direct to sit with you to make sure not only that you understand your post-discharge care plan, but that all of the follow-up appointments and care that you need and are going to require post-discharge is organized, appointments are made, you know where they are, you have transportation, and are able to get access. You know that they're in network, exactly. So, we've got a range of solutions that we can offer to support care management to make it easy for an individual to manage their health and well-being with the appropriate team-based support behind it. And I think it's a real differentiator for us as a provider organization that we're able to offer to these employee benefit plans.
No, it's very impressive. Again, to our listeners, Ryan McGarry, Chief of Staff for AME, filling in for President Dan Levler on this Sunday morning. Honored to have with us Nick Stefanizzi, Chief Executive Officer of Northwell Direct, talking to our listeners about Northwell Direct. And before we wrap up, Nick, is there anything you want to leave our listeners with this morning?
What I would say is first, it's been an absolute pleasure to be here, and I really appreciate.
Thank you. Thank you for being here.
Really appreciate the opportunity to chat with you and to share a little bit of the Northwell Direct story. What I would say is, we've gone through a really interesting time over the last 2 years, and we know that businesses are struggling as a result, and they're fighting really hard to get back to where they were before the pandemic and to continue growing and thriving. And that's really important. It's really important for Long Island. It's really important for New York. It's really important for the country. We have services and solutions that can help support that can help to make sure your workforce is healthy, is resilient, and able to do what you need them to do. And we are happy to talk to employers of all shapes and sizes about how we might be able to provide them with that support, and also to help bring savings to the bottom line. And at the end of the day, when we think about what's going on today in the talent market, how hard it is to recruit for positions that are needed to continue to grow and support businesses, people are looking to employers that are making the investments in health, well-being, and resiliency. And we believe we can be a partner to employers, help them become the employers of choice by showing their team members that they're making those investments. And we're really proud of the work that we're doing, really excited to continue to work with employers and union organizations.
As well, you should be proud, Nick. Thank you again for coming on, and thank you to our listeners. For our listeners, you'll be back with your regular host, Dan Levler, next week. Thank you.